obviously the mouth, and then from the mouth you're going to go into the pharynx. So the pharynx has 3 different parts. If you go back from the nose, that would be the nasopharynx. If you come back through the mouth, that would be the oropharynx. And then right above the larynx here would be the laryngopharynx. So food's going to come in through the mouth, go through the pharynx, then come down here through the esophagus. So through the esophagus, into the stomach. Right here would be the cardiac sphincter or the lower esophageal sphincter. Same thing, keeps the food in the stomach. Then you're going to go from the stomach into the first part of the small intestine, the duodenum, and this would be your pyloric sphincter here. And then you go from the duodenum, and then you come into the jejunum, and then that wraps around, and then you go into the ileum, and then you've got the ileocecal valve. This is the first part of the large intestine, the cecum. Appendix hangs off of the cecum. And then you go into the colon, so the ascending colon. You've got the hepatic flexure here, transverse colon, splenic flexure, descending colon, sigmoid colon, you need to kind of, this one's hard, you need to pull it up and look behind, but it goes sigmoid colon is behind here, and it's a little curvy, and then it goes rectum and then anus.
So anus is the whole thing here?
Yeah, it'd be this part right here.
So we cannot see the rectum.
Rectum is here, and you need to look behind it to see the rest of the rectum and the sigmoid colon.
Can you see the sigmoid
behind there?
on any models?
The ones that you can lift up and look behind.
Okay.
So when you look in the stomach here, the stomach has different parts. This would be the fundus. This most superior part right here is the fundus. This would be the cardiac region. This would be the body. And down here would be the pyloric region. This curve right here is called the greater curvature. And there's a piece of mesentery that hangs off of it called the greater omentum that goes from the stomach to the small intestine, connects these two. And this curve right here is called the lesser curvature, and there's a piece of mesentery hanging off it here called the lesser omentum that connects the stomach to the liver. These folds in here are called the rugae. When you look inside of the small intestine, you see these circular folds. Those are the plicae circularis. This would be the pancreas right here. See, when you look at the colon, these little pockets here are called the haustra, and these bands of longitudinal muscle are called the tennicoli. So then the liver over here, you have the different lobes. You have the right lobe, the left lobe, the caudate, and the quadrate. So right, quadrate, caudate. Right, left, quadrate, caudate. Okay. Gallbladders right here. You've got the hepatic artery bringing blood into the liver. We've got the hepatic portal vein bringing blood into the liver. The hepatic vein you can't see, it would be on the back side over here. The hepatic vein will drain into the inferior vena cava, which is this one. You can see the right and left hepatic ducts. They merge to form the common hepatic duct. The common hepatic duct and the cystic duct come together to form the bile duct that would go and drain down here into the duodenum, the first part of the small intestine. And you've also got the pancreatic duct coming from the pancreas, and that drains into the small intestine to the duodenum. And I think that's everything you can I guess down here you can see this would be the anus. These grooves are the anal sinuses. This right here would be the internal anal sphincter, composed of smooth muscle. And then out here is the external anal sphincter, composed of skeletal muscle. I think that's everything that you can see there.